Well, President Cyril Ramaphosa has also paid tribute to the nursing fraternity during his address on the first day of DENOSA's 9th National Congress. Now, the Congress is focusing on critical issues affecting the healthcare sector, including the implementation of the National Health Insurance. Ramaphosa says South Africa has a shortage of nurses and DENOSA should ensure training of those nurses. He's also made a commitment to improve the health sector, build clinics and hospitals. We have now roped in Russell Rensburg, Executive Director for Rural Health Advocacy Programme. Mr. Rensburg, thank you so much for your time this afternoon. Now, this conference comes under a backdrop, of course, of several issues currently facing the healthcare sector, including funding and infrastructure challenges, including most recently, of course, the withdrawal of US funding, as we've also just heard. Let's start with how big a threat do you view the shortage of nurses to the overall effectiveness of the healthcare system in line, with just some of the challenges that we've been speaking about?
Look, I think nurses are at the front line. The main drivers of an approach that's more focused on primary healthcare, which focuses on all aspects of health at the population level. Nurses are essential to improving maternal and child health services. Yesterday we celebrated World TB Day. Nurses play a critical role in initiating and keeping people in treatment. Nurses are the backbone of the health system. So we can't have any kind of health system strengthening without strengthening the responsiveness and supporting of nurses in the publicly funded health system.
Now, on the national insurance front, an act, of course, that DENOSA has also been calling for. President Ramaphosa says nurses will be the backbone for the NHI Act implementation. Given the current challenges within the fraternity and, of course, the health sector at large, give us a sense of the role nurses would then play, especially given the decline in training numbers that is of concern that the president also mentioned.
Look, obviously, the training numbers are linked to our ability to absorb, and as well as the president noticed in his speech earlier, as well as our ability to accredit new courses, right? So I think at the end of the day that this crisis is an opportunity. We can sort of re-emphasize or reorganize our healthcare funding, prioritize district health services, including primary healthcare, and in doing so, start working out the different career pathways for nurses. I think nurses need to be trained in clinic and operational management, and we need to have separate qualifications for that. I think nurses can be trained further to run small district hospitals. They can operate in independent practice, bringing their services closer to the community, and this is particularly useful in sexual and reproductive health services, which requires a little bit more sensitivity, and with our population getting younger, and maybe an opportunity for younger nurses to work outside of government, but in their own private practices. And a reform like the NHI will allow that.
So, and also, just talking about the NHI and perhaps some key learnings in the thinking, of course, of implementing some of these programs, when you consider, of course, the importance of nurses in the healthcare value chain, especially in the wake of COVID-19, I mean, the pandemic exposed long-standing weaknesses in the health system that we also spoke about in previous discussions, prompting necessary reforms to build more resilient quality healthcare for all. Just talk to us in terms of where are we now, in as far as that is concerned, just in terms of building those resilient sectors and talk about the reform levels too within the sector.
Look, I think the president in his State of the Nation speech actually put primary healthcare right at the foreground. Right? He spoke about strengthening district health services, including strengthening the response for maternal and child health. Over 1 million babies are born in the South African system each year. We need to improve that experience. He spoke about infectious diseases, and I think this recent decision by the 47th president to withdraw funding from South Africa sort of puts that in focus again. Strengthening responses and responsiveness of the health system to long-standing issues like HIV and TB. The third component is how do we better support people living with non-communicable diseases. And then lastly, the successes of the HIV program has meant that people's living longer as well. So we need to start reorganizing our response for older people. When you're over 55, your healthcare needs are different. And we need the public sector to respond to that differently. Much in the same way as we need different kinds of service option for young working families, where they can access healthcare where they are and where they need it. And I think by focusing the reforms at this level of the health system, we can have the biggest impact, because that's where 80% of the people utilize services. We can reduce expenditure at the higher levels of care, like your tertiary hospitals, which shouldn't be delivering primary healthcare services. But the main thing that the president and what was followed through in the budget as well is the investment in health management information systems to help us better understand what are the things that we need to do now in order to ensure optimal use of the resources we have today. Because no more money is not coming. And filling the 6 billion gap left by the previous donor development assistance, will be hard, but we need to use this as an opportunity to start building a more client-focused and responsive system. And nurses, particularly professional nurses, are a critical part of making that a success.
As we wrap our conversation, I want to come back to this point. I mean, in an environment where many of our nurses have opted to leave the country for, among others, better wages, even DENOSA members have voiced, the growing concern over unsatisfactory wages, difficult working conditions in recent years and months. I mean, you speak of investment. Where should the focus be when we speak about these nurses that are opting to leave the country?
Look, I think we have to find a balance, and that we really need to know more. Currently, we have a bit of a demographic transition in our nursing population. We're close to half of those currently, or over half of those currently working in the public sector are approaching retirement age, and often that's the time when they, at 55, decide to move on and go and work elsewhere. I think our main priority at the moment is figuring out how do we make the nursing profession attractive for young people, and young women in particular. And I think we need to look at different career paths or pathways into the nursing profession, right, to allow more young people, particularly those in rural areas, to start seeing this as an employment opportunity. And I think the government on their side can make sure that they create the bursaries and the working opportunities for people to find work, right? These care services are bound to grow globally as the populations get older and are more in demand. And the notion of people, medical professionals in particular, moving around is not new. I just think in our environment, we need to now focus on how do we create pathways into the profession for underprivileged and deserving students to make the profession worthwhile. And I think that the crisis now is a moment to start investing in that. But we're not going to solve it overnight.